Janet Dillard, and welcome to Health News You Can Use. The 30-bed ventilator unit at Kingsbrook's Rutland Nursing Home is a specialized unit that provides skilled nursing care for ventilator-dependent residents. An interdisciplinary team comprised of a board-certified pulmonologist, nurse practitioner, respiratory therapist, and charge nurse oversee the clinical plan of care. This unit has an incredible weaning rate of over 90% of patients successfully being removed from ventilators to breathe on their own. Today we are joined by the vent unit team, Sharon Hackett, adult nurse practitioner, as well as Wendy McGuire, registered nurse. Thank you guys so much for coming today.
Thank you for having us.
I'd like to start by first asking you, what role do each of you play in the vent treatment process? So tell us a little bit about your title and what you do there.
Okay. I'm the nurse practitioner, and my role as a nurse practitioner is to diagnose, treat, run lab tests, interpret, and provide care for the ventilator-dependent patients, as well as some tracheostomy patients.
And so your role then, working with the RNs, are very, very close, working with the physicians are very close. You're part of a multidisciplinary team then?
Yes. I'm part of a multidisciplinary team consisting of the charge nurse, the registered nurse, the dietitian, the social work, the respiratory therapist, and the certified nurses assistants, we can't forget them, as well as consulting and collaborating with other physicians, for instance, an infectious disease physician, or GI doctor, or endocrinologist, depending on the patient's needs.
So Nurse McGuire, tell me a little bit about what you do and the role you play in the vent treatment process.
I'm a registered nurse. My role as a registered nurse is to first assess the patient. If there is a problem, I will address it with Ms. Hackett or the doctor that's covering. I administer medication. I do patient care. I do trach care. I do patient teaching. And I work in collaboration with the respiratory therapist and the doctors.
Okay. So tell me a little bit about what happens when a patient arrives on the vent unit, Ms. Hackett.
Okay. When a patient arrives on the vent unit, either from another facility or from Kingsbrook Acute Hospital, they're accompanied by a respiratory therapist to their unit, to the bed. A team accompanies the patient, a nurse, the respiratory therapist, CNA, physician or the nurse practitioner that's on to assess the patient and start admission procedures.
Okay. Now, when patients come on the ventilator unit initially and there's a family element, how do you prepare families when they're dealing with this type of medical transition?
Okay, this can be very difficult for family members to see their loved ones on a ventilator. So a compassionate approach is made towards the family. Hopefully, before the patient gets there, they can come and tour the unit and see what the unit is like. But when they are there, they are abreast of what's going on with the patient. And after the patient's been admitted, for maybe about a week or into the admission, the family is gathered and we have a patient family conference where it includes the social worker, the nurse, the respiratory therapist, the dietitian, and and me when I'm available. And in this conference, we abreast the family member what's going on, what our goals are, and what to expect and what not to expect. And then the family would in turn tell us what they have seen and what they expect, and it's a collaboration and interaction between family and staff.
Right, and let's talk about those expectations because of the types of patients, and we'll talk more about that are admitted onto a ventilator unit. What are the expectations at times, and what are the expectations most families have, and what are the expectations that sometimes they have to take your advice with? In terms of the degree of the illness of the patient?
Okay, many of our patients, if not all, are very sick. They have multiple comorbidities, meaning they have multiple problems in addition to their respiratory condition, such as diabetes, strokes, hypertension, multiple sclerosis, COPD, very a lot of diseases that impact on their respiratory condition.
Right.
And so the family should expect quality care from us, but they should also expect that these patients sometimes cannot be weaned successfully, and that they may be a lifelong ventilator patient. We make every effort to wean all our patients from the ventilator, but if it's not feasible, then they have to remain on the ventilator.